From KUNC and the NPR network, this is In The NoCo. I'm Erin O'Toole. In most states, if someone repeatedly hasn't paid a medical bill, collectors can eventually go to that person's employer and garnish their paycheck, which means they withhold a portion of that person's earnings to pay off the debt. Critics of wage garnishment say this practice disproportionately affects lower-income patients. Now, a bill at the Colorado State House would effectively prevent debt collectors from doing this and would make Colorado one of the few states in the U.S. to ban the practice. But some opponents say that would ultimately drive up the cost of healthcare for everyone. Ray Ellen Bichelle wrote about this for KFF Health News, which covers healthcare policy. She spoke with me about why the practice is controversial and how this proposal might affect it. So, Ray, could you just briefly explain the process of wage garnishment? How does someone go from getting a collection notice to then having some of their paycheck siphoned off to pay a bill?
Sure. So say you're a patient who received a procedure at a certain hospital or medical center and you didn't pay the bill for whatever reason. The medical center, the provider, they can call you a bunch of times, try to get you to pay it. If that doesn't work, they might say, okay, debt collector, can you try to collect this for us? And then you'll be hearing from a different entity, this debt collector that maybe you haven't heard of before. And they'll be saying, enter into this payment plan. Otherwise, we'll have to take you to court. If that still doesn't work, then they can go to court and they ask the judge for permission to go straight to your employer and make the employer funnel a chunk of your paycheck to them, to divert it to the debt collector to pay off that debt. So then you, the patient, would see a smaller paycheck.
You reported on the use of wage garnishment for medical debt in Colorado. In that reporting, you talked to a woman named Nicole Silva. Talk about how her story underlines the ways that wage garnishment can have ripple effects on someone's life.
Yeah, Nicole's story has really stuck with me. So Nicole is a preschool teacher, and she and her family live south of Alamosa. She and her husband have 4 kids. They're also raising 2 nephews, so busy family. And they had Medicaid coverage when her daughter, many years ago, was in a car accident and needed an ambulance ride to a nearby hospital for treatment. Fast forward a few years after that accident, and it turns out a debt collector got permission to garnish her wages to pay back the ambulance bill, even though it should have been billed to Medicaid, not to the family.
Right.
It can be a really complex system. So Nicole didn't know how to reach the right office to show that she had Medicaid, and she didn't have time to take off work to go to court. So in the end, her wages were garnished. And for this family, that was really meaningful. She told me they had to decide at one point between buying groceries or paying off the electric bill. And they chose groceries, and their electricity got shut off.
You estimate that Colorado courts have approved wage garnishment in something like 14,000 cases. We mentioned earlier critics say it disproportionately affects lower-income people. Ray, what did your reporting reveal about who is affected?
Yeah, so I'll just say broadly, medical debt affects many, many Americans. My outlet and a few other outlets did a big look at this and found that, more than 100 million people in the U.S. and 41% of adults in the U.S. were saddled with medical bills they couldn't pay. So this is like a feature of being in this healthcare system. But what my review of Colorado records showed is that when we're talking about wage garnishment specifically, which is considered like kind of an aggressive form of debt collection, that was affecting people in a wide array of jobs, but for the most part, they didn't stand out as like very high income ones. So we're talking about people working in ranching, construction, school districts. I saw several people who were working at Walmart, Family Dollar, and then a bunch working at grocery stores, gas stations, restaurants. So, we can't see exactly what their income is, but we know that these are not, CEOs and investment bankers.
Your reporting also found billing mistakes do happen, as you mentioned in Nicole Silva's case. How often did you find that someone had their wages garnished in error?
That one is a hard question to answer. It's one of the reasons why they say that medical debt should be treated differently from other types of debt, because when you go to the doctor, you don't know how much you're going to owe. But the overall thinking is that errors are pretty common. And so in the worst case scenario, I think you have people who, like Nicole, get a bill that they didn't even owe at all. She didn't owe a penny of that bill. And yet she still got sucked into this like pretty complicated court system process. And she wasn't the only one that I talked to who had billing errors too.
Well, I want to talk about the bill that State Representative Javier Mabry introduced last month. Colorado is one of 8 states seeking to rein in the practice, and Mabry's bill would ban outright wage garnishment for medical debt. What kind of difference do supporters think that will make?
When you talk to patient advocates, they think that that's an important step. You'll hear the term like, you can't get blood from a turnip.
Yep.
And that's what people who really think about wage garnishment and who it impacts a lot, that's what they think this system is, that it's kicking people when they're down, that it's not really going to recoup that much money anyway. There was one study that showed that only about 0.2% of hospital revenues is brought in through wage garnishment. And so that gives you an idea that wage garnishment might not make that much of a big impact on hospital revenues, according to studies like that. But it can, as we talked about before, make a big impact for patient finances. Wage garnishment is just one element of protecting people from medical debt. What you'll see also in this bill in Colorado and several bills in other states is some other elements too, making sure that like payment plans are offered at reasonable rates, or putting sort of an expiration date on like how old the hospital bill can be before you can't collect on it anymore.
Right.
And then also credit reports, making sure that people can't get their credit reports dinged because of unpaid medical bills, which Colorado really led the way on.
Debt collection companies don't particularly like this bill. They say that they have seen clinics close due to a loss of revenue. The Colorado Hospital Association spoke out against it with a spokesperson saying, hey, hospital care costs money to deliver. Ray, how likely is it that healthcare providers would lose revenue if this collection method is no longer available to them?
It's something I haven't reported on directly, so I can kind of speak to what I've heard. The biggest pushback on these kinds of medical debt protections really comes from the debt collectors. And it's the debt collectors, their big points are what you just mentioned, right? But then the flip side of that is that a lot of people that end up having their wages garnished likely were eligible for charity care, likely were eligible for public health insurance programs. And so what you find is there's this sort of tension between providers being able to recoup the money that they're owed without that affecting people who actually should have gotten discounted care or free care. And so it's really like finding the path, the balance there that's at issue.
Ray Ellen Bichelle covers healthcare policy for KFF Health News. We'll share links to her reporting on wage garnishment for medical debt in our show notes and at KUNC.org. That's it today for In The NoCo. I'm Erin O'Toole. Thanks so much for listening.